All right, so listen carefully. So these are the cues that I give to the patient because I feel like this test, the verbal cueing is really important. So I want you to tuck your chin in a little bit, your mouth closed as you do that, and lift your head about 1 inch off the table and hold it there. Now, if you have pain, and now I'm looking at the clock, if you have pain or any discomfort, then you stop. Okay, so how are you doing so far? Here's the wrong way to do it. Just lift your head up for me, okay? Okay. So when she does that, that is incorrect. If you see a lot of sternocleidomastoid action happening, she is doing it wrong, okay? All we're doing here is we side bend them toward the painful side, and we just press downward, okay? So I'm pressing down with about 10, 15 pounds of pressure. If she has pain that radiates down her arm, that's a positive Spurling's test, okay? Pain in her neck is not necessarily positive as much as it is pain that kind of radiates. We bring her head back into extension. Now, I want you to keep your eyes open, and I'm just going to rotate her to one side, okay? And just keep your eyes open, and we just hold this for 10 seconds. And I just ask her, are you feeling any strange symptoms at all? If she starts to feel dizzy or nauseous or anything like that, if you see nystagmus, if any weird symptoms, pain is not a positive finding, all right? It's everything other than pain. But if you have somebody that's probably older than 50, you probably should do this as a routine part of your examination, okay? Because there are a lot of techniques. Again, if she's got a positive vertebral artery test, I'm not going to do any rotation. I'm not even going to test her rotation. So that limits some of my diagnostic tests. I'm under the occiput with my thumbs here, and I'm just lifting upward. Okay? And I ask her, does this decrease, increase, or have any effect on your symptoms at all? And then our compression test is just hands on top of the head. I am just pressing straight down. I'm giving a fair amount of force here, and I'm asking, how does that feel? All right? If she says no effect, great. If she says that brings pain down my arm, it probably means she's she would benefit from choice. If she says this does hurt and this doesn't, that's dis. Is that what? Okay, good. And if she says this doesn't hurt, but this does hurt.
Posterior column.
Posterior column. This is just like the lumbar quadrant test. So we want to compress these facet joints on the right side. If I want to do that, I bring you to extension, right rotation, right side bending. Okay? And I can do it all in one motion here. And I say, how does that feel there? Yeah, right. It's got to hurt on that side for it to be positive. And I should get a hard end feel here. So you want to take them back far enough so you can feel the end feel.